Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on Pulmonary and Critical Care. Let's get started with question number 1. For the following case, electrical stimulation of which of the following nerves may improve the pathophysiologic cause of this patient's symptoms? A. Hypoglossal nerve. B. Lingual nerve. C. Maxillary nerve. D. Phrenic nerve. E. Recurrent laryngeal nerve. The case scenario is: a 57-year-old man comes to the office due to unrefreshing sleep. He feels tired during the day and occasionally has to nap during his lunch hours. According to his wife, the patient snores loudly during sleep and frequently gasps for breath. He also has severe claustrophobia. Past medical history is significant for hypertension. The patient takes no sedative medications and is a lifetime non-smoker. Blood pressure is 156/94, BMI is 30 and other vital signs are normal. Physical examination is significant for a bulky tongue and crowded and narrow oropharynx. The question is: electrical stimulation of which of the following nerves may improve the pathophysiologic cause of this patient's symptoms? Your options are: A. Hypoglossal nerve. B. Lingual nerve. C. Maxillary nerve. D. Phrenic nerve. E. Recurrent laryngeal nerve. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is A, which is hypoglossal nerve. This question is designed with the focus to assess your ability to apply foundational science concepts. Obstructive sleep apnea is characterized by recurrent episodes of upper airway collapse during sleep. Anatomical and neuromuscular mechanisms have been implicated in obstructive sleep apnea. Neuromuscular weakness as a pathogenic mechanism in obstructive sleep apnea is supported by the fact that apneas occur only during sleep, a time of muscle relaxation. The upper airway dilator muscles weaken during the transition from wake to sleep, leading to airway narrowing and ultimately collapse in individuals with obstructive sleep apnea. Stimulation of the hypoglossal nerve using an implantable nerve stimulator causes the tongue to move forward slightly, increasing the anteroposterior diameter of the airway. Studies with these devices have shown a reduction in the number of obstructive events during sleep. If you choose any option other than A, you are wrong. Let's briefly discuss the other options. Choice B cannot be the answer because the lingual nerve arises from the mandibular division of the trigeminal nerve and supplies sensory innervation to the tongue. So this nerve doesn't provide motor innervation to the oropharyngeal muscles involved in obstructive sleep apnea. Choice C cannot be the answer because the maxillary division of the trigeminal nerve provides sensation to the midface area. Like the lingual nerve, the maxillary nerve also didn't provide motor innervation to the oropharyngeal muscles involved in obstructive sleep apnea. Choice D, the phrenic nerve supplies the diaphragm. Although diaphragmatic paralysis can cause sleep apnea, obstructive sleep apnea with loud snoring and gasping respirations is due to oropharyngeal rather than diaphragmatic dysfunction. Choice E cannot be the answer because the vocal cords are innervated by the recurrent laryngeal nerve, but sleep apnea is primarily a problem of the pharynx, not larynx. Your take-home message from this question is that neuromuscular weakness of the oropharynx is involved in the pathophysiology of obstructive sleep apnea. Electrical stimulation of the hypoglossal nerve increases the diameter of the oropharyngeal airway and decreases the frequency of apneic events. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.